Hello, welcome to Dr. Aparna's Healthcare. So today we are going to discuss about the various triggering factors of migraine as well as what are the home remedies that we can try to prevent the recurrent attack of migraine. So to understand that, first let's understand what is migraine headache. So it's a unilateral pulsatile headache associated with nausea, vomiting as well as blurred vision. So by unilateral we mean the one-sided headache, and pulsatile means headache with throbbing kind of pain. So it's a one-sided headache with throbbing kind of pain associated with nausea, vomiting as well as blurred vision. So to understand the symptoms of migraine, first we need to understand that the migraine has got 4 different phases. So the first phase is the prodrome phase, followed by it is the aura, then the headache and the postdrome phase. So let's see what are the symptoms of the prodrome phase. So during the prodrome phase, the patient experience extreme fatigue or extreme tiredness, and the patient also keep yawning continuously. There will be repetitive yawning during this phase. The person will also have extreme sensitivity towards light as well as towards sound. So that is called the extreme sensitivity. Increased sensitivity towards light is called as photophobia, as well as increased sensitivity towards sound and unwanted fear towards sound is known as phonophobia. So this phase is mainly marked by photophobia, phonophobia, etc. The person will have excessive craving towards certain type of food. The person also will have excessive thirst. So this excessive thirst, increased craving for certain type of food, extreme tiredness, these are all related to increased dopaminergic activity in the hypothalamus part of the brain. Also, there will be changes in the temperature perception. As a result, the person will experience increased cold sensitivity as well as increased sweating during this phase. Next phase is the aura. So during this phase, the person experiences visual or auditory aura. So by visual aura, the person's vision may be reduced or there will be loss of vision, or in the visual field, they may experience some defects. Sometimes they may see bright flash of light, or sometimes there could be a spot of bright flash of light in the center of the visual field, and this is called the scintillating scotoma. They could also see different shapes in front of their vision. They may also experience ringing sound heard in the ears. They may also feel that their hearing power is reduced. So these are all some of the aura felt by the person. They may also feel like the needles or pins are pricking them. So this is called paresthesia, that is abnormal sensation could also be experienced by the patient. The next phase following this is the headache. So during this headache phase, as we said, it is a unilateral headache, that is one-sided headache with pulsatile or throbbing type of pain. So during this type of pain, the patient may experience associated symptoms like nausea, vomiting, as we said, photophobia, that is increased sensitivity towards light, or increased unwanted fear towards the sound, that is phonophobia. They may also experience symptoms like pain in the muscles of back, pain in the muscles of neck, etc. associated with it. There will be also excessive lacrimation, that is tears may come out of the eyes, or excessive discharge from the nose during this phase. So the time period of this headache phase can vary from 3 hours to 72 hours, and the nature of the pain will be very severe. The patient may complain of excruciating type of pain, and this pain, it is aggravated by physical activities and is ameliorated by rest. And we also notice that the patient will come and tell that the pain would get relieved by vomiting completely. And the patient during this phase, they want to be in a very quiet room without any bright light or without any noise. In a very dark room, they want to sleep and take rest. So following the phase of headache is the post-drome phase. So during the post-drome phase, the person experience excessive tiredness, irritability, there will be difficulty in concentration, on all these problems. So these are the different symptoms experienced by the patient in the 4 different phases, and it is not necessary that the person should experience all these 4 phases. Sometimes a patient may present with migraine without the aura also. Now let's understand what are the triggering factors of migraine. So the most significant and the most common triggering factor is stress. So 80% of the cases, the migraine is triggered by stress. So it could be any kind of anxiety, tension that you experience in your home or in your workplace, or it could be related to your financial stress, everything. So any kind of stress is a very common and important triggering factor for migraine. The next important factor is associated with the menstrual cycle. So during menstruation or during ovulation, we know that there will be hormonal change, and this can actually trigger a migraine attack. So if you see the occurrence of migraine in females and males, in females it's more common. The ratio in females, like female to male ratio, is 3:1, and the reason is because of the hormonal change taking place in females every month. And if you see in pregnancy also, during the first trimester, that is in the initial months of the pregnancy, the chances of getting the migraine attack is more, and during the later months of pregnancy the chances would be reduced. Another important triggering factor for migraine is excessive exposure to light, that is when you are more exposed to bright light. Okay, and exposure to noise is also another triggering factor for migraine. Change in weather is another important triggering factor. So this could be any change of weather could actually trigger migraine, especially if it's a summer season or stormy winds is excessively, it increases the chance of getting an attack of migraine. Another important factor associated with migraine is excessive exposure to heat. So this could be the heat of the sun, or in cooking, in women, especially during the time of cooking and all, it could be the heat from the gas stove. So this also can trigger an attack of migraine. Another important factor that triggers a migraine is your habits like smoking, drinking, etc. And also any change in the lifestyle could also trigger a migraine attack. So any change in lifestyle means any deviation from your daily normal activity can actually lead to a migraine headache. So this may be the sleep deprivation, that is one, when you are deprived of sleep, it can lead to a migraine attack. Also excessive sleeping can lead to can trigger an attack of migraine. So sleep deprivation is the cause for migraine in 25% of the cases. And excessive sleep can also trigger migraine in 2.5% of cases. That is, normally if you are a person who sleeps for 8 hours a day, if you don't get this much amount of sleep, it can also lead to migraine. Or if you sleep excessively on a weekend, it can also trigger an attack of migraine. So these are some of the triggering factors of the migraine. So apart from this, we have the dietary triggering factors also for migraine. So the diet which triggers a migraine attack, it includes caffeine, chocolate, dairy products, and these dairy products include milk, cheese, etc. Then also the beverages which contain soda, artificial sweeteners, the MSGs, monosodium glutamate, which is usually present in the instant noodles, Chinese food, processed meat. So these all can trigger an attack of migraine. So what is the cause of this migraine? So migraine is actually caused by cerebral vasodilatation, that is abnormal dilatation of the blood vessels of your head. That is the cause for migraine, and we do not actually know what actually causes this abnormal dilatation. Actually, hereditary plays an important role in it. That is, if one of your parents has migraine, there is 40 to 50% chance that you may get migraine. Also, if both of your parents have migraine, there is 70 to 80% chance that you get a migraine attack. Okay, stress is also another important factor which contributes to migraine. Age group that commonly gets affected by migraine is between 15 to 40 years of age. By 45 to 50 years, the chance of getting recurrent attack actually declines. Now let's understand what should be done if you get a migraine attack. So if you experience any of the following symptoms that we discussed above, do not wait, consult your doctor as early as possible. Actually, homeopathy offers a very good cure to migraine. Apart from the medication, we can try some home remedies. So one such home remedy is the ginger tea. So in the boiling water, you can add few leaves of neem, add 1 amla as well as grated ginger, and add a pinch of turmeric to it, and you can make a decoction of it, and taking this tea during the time of severe pain, it helps to relieve the pain. Another thing you can do is massaging with the sesame oil. This also helps to bring down the pain to some extent. However, you can do some of the yoga asanas in order to prevent the recurrent headache to occur. Like, in order to prevent the occurrence of headache, you can do these asanas regularly. So the asanas which helps to prevent the recurrent attack of migraine include Sedu Bandhasana, Hastapadasana, Balasana, Shavasana, Pranayama, etc. So I think you got an idea regarding the migraine, the triggering factors, what can be done if you get a migraine attack and all this. So if you have any further queries, you can contact me, Dr. Aparna's Healthcare. Thank you.